It's a great honor for me, and thanks to David and the network. As David has said, I have been a member of the advisory board of the network now for a couple of years, and it's a great honor to be a part of this virtual conference today. We had hoped it would be in Dublin, but unfortunately, the way COVID has panned out did not permit that. But the faculty remains and is delighted to be a partner on what we consider to be a very important network, a global network and an interprofessional network. So thanks again. I am presenting as an academic partner with a technical partner in the College of Surgeons and in the faculty itself. And there are colleagues who are not speaking but will be watching today, namely Chris, Richard and James, among a team of technology experts. And for those of you who know me, technology is certainly not my strength. I was panicking beforehand with Matteo to make sure at least you could see my presentations, but be assured and be reassured that behind this presentation there are people who know what they're doing in terms of technology. And as David has rightly said, we are working on and presenting today on a passport, an electronic solution that will enable interested stakeholders at a national but also at a local level identify the credentialed capabilities, competencies and skills of any member of the team within the health services. And the work that we're doing in relation to this has advanced quite significantly over the last 12 months or so. We are working with our ministry, our Department of Health and our Chief Nursing Officer. We are working with the National Director for Human Resources within our National Health Services, the Health Service Executive. We are working with the private sector in relation to community care and private and independent hospitals. And indeed, we're working with the nursing home sector under the umbrella of Nursing Homes Ireland. And I think with the team, that is the theme of the conference, being team-based learning. What has been amazing for me as someone who's towards the end of my professional career is that working with colleagues who are not part of your usual team has been a phenomenal learning experience. And working in the Royal College of Surgeons in Ireland, a university of medicine and health sciences, the R, the C, the S and the I in terms of our values are centered on research, collaboration, scholarship and innovation. And what we are presenting today reflects a collaborative innovation whereby we are trying to think outside the box. And while we as professionals are very good at talking to each other, sometimes the word earlier was mentioned in terms of silo, we are improving in relation to talking to other colleagues within our network, be it clinical or academic or research, but it's also critical that we look to real others. Engineering was mentioned, design was mentioned by other speakers this morning, and it is within that capacity that I'm speaking in relation to being a member of the board of Axia Digital Interactive. So the Faculty of Nursing and Midwifery a couple of years ago established the Irish subsidiary of Axia, a digital company, and it's based in our faculty. So the offices of this company are based within our faculty. And you know, we believe this is an innovative way of strengthening and utilizing the strengths of partners both within and outside the college. And we have a number of products that we've developed in terms of supporting the lifelong learning and the competence assessment and the continuing education and the CPD agenda for healthcare professionals right from the beginning of their professional career until the end of that professional career. So those products already exist. And building on that, I want to take you back some of the anecdotes for me personally that have driven the development of this innovation that we're going to talk about today. Before I came to the RCSI in 2014, I worked for a long time in regulation, professional regulation. And there was a tragic number of deaths of newborn babies in a hospital within a region in Ireland. And at that time, I was working in regulation, and parliamentary questions came into us in relation to the amount of courses that we as a regulatory board had accredited for nurses and midwives in terms of CTG monitoring. And we had developed a national system for the approving and monitoring of continuing education for nurses and midwives in our jurisdiction a long time ago. And we updated it in 2009 when we introduced continuing education units. So the parliamentary question came into us, how many of these CTG monitoring programs had we approved? And we were able to tell them because the system was electronic. The subsequent question we weren't able to answer. And that question was how many midwives or how many nurses in X hospital had conducted or completed that program. We couldn't answer that, nor should we have been able to answer it at the time. It wasn't a question that we should be answering, but it was a question that someone needed to know the answer to. And when you then come forward a number of years, I moved into higher education, or back into higher education in my case. During the outbreak, the initial outbreak of COVID-19 last March, April, I was in one of our academic teaching partners and academic clinical partners working, and I met an advanced practitioner from a different service who was providing an assessment service to my faculty. And I asked her how things were going, and she told me that as an advanced practitioner, she had been redeployed into an intensive care unit. And the method of that redeployment was she met a nurse directorate manager who she used to work with 14 years previously in the intensive care unit. So she was taken back into a quite intense, sorry for the pun, clinical environment to help support or bolster the staffing challenges being faced within that intensive care environment 14 years after she had left working in that area. And it got us to thinking, you know, this is no way to manage a service in terms of skill mix and in terms of reallocation of staff. And we felt, because work was being done by my colleagues in AXIA, that this was an opportunity for us to explore creating an electronic solution whereby questions such as, you know, what are the capabilities of my staff? What are the competencies of my team across the hospital or of our employees across the service? What are they? When have they been achieved? You know, what is their recent and relevant experience in relation to a specific context? And not having to depend on someone recalling working with you 14 years previously to bolster the skill mix within the service. And I don't know about your own jurisdictions, but there's been a lot of work on skill mix and safe staffing research in Ireland and in Europe and indeed globally. And many of the concerns that have been raised in relation to COVID-19 is its impact. We're arguing that we know many we have to determine whether our skill mix is safe or critically, quality, capability, and it's within content background. We have an electronic solution to dealing with the assessment of and access to credentialed competencies, any staff within a, be they healthcare, be they nurses, be they midwives, be they allied health professionals, across a range of living care from home up to the acute care of patients in intensive care units. So what my presentation is going to describe is a solution between the Faculty of Nursing and Midwifery and the Axia Digital Ireland company based in our faculty. It's a complementary solution that works with alongside and interoperates with solutions and platform that we have developed in terms of supporting the ongoing learning and assessment of students and registrants throughout their professional career. So our working basis, and we have ascertained this information, this is not something we are making up, is that currently in Ireland, there is no composite repository of healthcare staff, their competencies, their capabilities and skills. And what has been demonstrated to me and others is that health service leaders, clinical managers, human resource managers are challenged to have access to a valid and reliable platform to access and indeed assess the capabilities, competencies and skills of staff, how they've been achieved and when they've been achieved. Because for those people who know me, I'm almost 30 years out of clinical practice. While I may have clinical skills that are 30 years old, how relevant they are to any meaningful scope of practice today would be very, very questionable. So what our solution is designing is a platform that will offer human resource managers, clinical directors, to identify their existing skill mixes and to identify their existing skill mixes and the capabilities of the staff they have, but also critically to be able to identify where the gaps are. So if I go back to my colleague who was asked to step into the intensive care unit after being out of it for 14 years, a system like this would have enabled at the click of a button of the services to identify if from her teams across the services was there people with more recent, relevant clinical experience in that context. So to ask who has experience, and you could cut that off at a point in time. It could be a 3-year time frame or whatever is determined as appropriate or evidence for. From that, you will be able to draw on a cadre of individuals who have more recent relevant experience in the area where the deficits exist currently. So what our proposed solution is enabling is the access to the current individuals in the services deemed capable and competent, and indeed tracking your colleagues across these services. So our solution is an opportunity to strengthen human resource management of skill mix across the services. And it provides an opportunity to effectively and efficiently manage credentialed practice expansion and extension. As our services, and those of you who are working in clinical practice know this better than I do, our services are being changed and challenged and reconfigured on a rapid basis, constantly. Having access to a solution like this would enable the directors, services managers, or human resources management identify where the skills are needed, if they are needed, and where the capabilities are needed, if they are needed, to expand existing or change existing or extend existing practices. So what the solution is providing our health services is with an opportunity to identify existing staff capabilities and competencies based on current service need, assess the capabilities and access the capabilities, competencies and staff across their teams, and of course, monitor and manage needs and deficits as our services are changing. And we've put up a number of skills and capabilities here today that could be included in an individual's, linked to an individual practitioner. These are only a small sample. The capabilities and skills that are going to be captured will be linked to the scope of practice, the context, the setting, but critically, the individual practitioner. So they will range considerably from a healthcare assistant to a physiotherapist, to an advanced nurse practitioner, to a midwife. And depending on that, we will be able to track and upload the competencies and capabilities of individuals across a range of skills that are required within the service. Many of you will know that there was some significant work done by ourselves, by the health service and others in many jurisdictions at the start of this pandemic in relation to upskilling people, in relation to infection prevention and control, in terms of using PPE, in terms of donning and doffing PPE. These are the type of skills that we feel could be captured in our solution to enable the future proofing and of our services and our skill mix. Because while today, or for the last years it is now, the issue has been COVID, the reality is we should not be responding to challenges like this in a way that's behind the curve. We need to be responsive and systematic and strategic in terms of developing the infrastructure to enable us not anticipate some of these challenges, but respond in a more timely way to them. And I think it's critical, and what's a wonderful component of this tool is it allows the services identify the specific skills and capabilities and competencies needed by their staff, whomever they are, whatever grade they are, whatever title they have within the particular service, and capture that in a meaningful way. And I hate when people put up slides like this, I really do, but I'm going to do it anyway. And I know that we always refer to things like this as being very busy slides, but what I'm trying to capture here is that from the ground up and from the top down, so from a regulatory and from a national service need and a policy need perspective, you have coming down, a driver for what is needed, but also from the ground up, you have a range of skills and capabilities that are not exclusive, but are a snapshot of what can be needed from the ground up to match service delivery, to match the implementation of health policy across a range of services, across a range of scopes of practice, to ensure that the services that are needed within those various different scopes of practice are being delivered, are being monitored, are being assessed, and are being accessed to ensure we are all as individuals contributing to delivering on health policy, whether you're working in somebody's house or whether you're working in an intensive care unit in a large academic hospital, whether you're working in residential care, whether you're working in maternity care or mental health, it doesn't matter. This tool, this passport, this electronic solution will enable the capture of data that's relevant for the service from the bottom up to ensure the delivery of our health service policy from the top down, and indeed regulatory standards from the top down as well. What is interesting about a solution like this is, and this is something that has become more and more critical within services, and indeed more and more of a challenge for services, is that the solution can provide and generate significant reports in terms of capturing data for a range of organizations in relation to what exists currently within the skills of the workforce. And I've mentioned a number of organizations here. So for example, INHWE is an umbrella body that has about 500 nursing homes as members. INHWE is in Ireland is the health service organizational regulators, the Health Information and Quality Authority. And for example, within the services that INHWE regulate, they look for evidence and they look for data in relation to what professional development, what skills, what training, what capabilities and competencies do the staff and the services have. This tool would enable the report to be generated electronically and submitted to the regulator. Working with our health service executive, our national health service, it would enable at the most senior level, human resource workforce planning data to be captured. Some of the challenges we face in this jurisdiction is that we can identify X number of nurses and midwives, for example, and I apologize, this is my own profession, so I'll speak to what I know. But when you look at a regulatory register of nurses and midwives, it doesn't necessarily give you access to real work on time and in time data in relation to how many of these are available to provide services. And I keep going back to myself. Well, I am on a register of the nursing board here in Ireland. I'm not in practice. I'm not contributing to the clinical workforce. Data like this is really important to government departments who are trying to assure itself that we have the skills to deliver on rapidly changing health policy. Individual professional regulators like the Nursing and Midwifery Board, like CORU, which was mentioned earlier on as the regulator for allied health professionals in this country, data being made available to the Mental Health Commission, which regulates at an organizational level our mental health services in this country. So this solution provides data, big data, in relation to being fed up the food chain, if you like, to the Department of Health, our ministry, to individual regulatory bodies. And this is in addition to reports that can be generated for local clinical and human resources management. And we believe that that's fundamental because it has been our experience, our lived experience over the last number of years. And this has been verified in the meetings that we are holding and having with these key stakeholders, be it policy level or be it a service delivery level, that this is the type of data that is needed, but this is the type of data that we do not have access to. Just also trying to show you that if you focus on one of those very broad areas that we had at the start, we focus on the national nursing home sector at the moment. And as in many jurisdictions, the residents, our future older selves, as a colleague of mine calls it, have suffered very, very badly in relation to the impact of COVID-19. And there've been a couple of reports generated, some high-level expert reports generated in relation to the challenges being faced and in the nursing home sector. And our solution is keenly developed to enable the challenges that have been faced and documented tragically in some cases to be addressed from an individual home perspective, from a group home perspective. And this slide, again, a busy slide, enables you to at least get a sense of the fact that while we can have the bigger picture across all the range of services, we can then drill down to individual care homes, to group care homes, to umbrella organizations within a single scope of practice, such as aged care in this sense. And then if you even drill down further at an individual level, you can enable an interdependent relationship to be developed between an individual practitioner, no matter who they are. I've identified a nurse in this case, but it could be a healthcare assistant, it could be another, to enable them to capture their skills and the skills that they need to be able to deliver their effective care to a local, through a local management system, through the director of nursing or the human resources manager within their services, and then allow that data to be interdependently fed up to meet the needs at national level. So some of the reports that have come out and the expert reports that have come out in relation to COVID-19 and the nursing home sector is beginning to explore national competencies and national skill sets that the regulator INHWE and others will be working on to ensure that better, safer, evidence-informed care is being delivered within the nursing home sector. So our solution today that we have developed enables that interconnectivity between the bed care required at the bedside, care being managed within a confined organization. It could be a 100-bed nursing home, all assuring and ensuring that the services are being delivered by people who are skilled in a way that meets the needs of the individual clients and residents locally, but benchmarked against the national standards, which are evidence informed. So some of the product features are that what we have developed is a cloud-based scalable platform. And of course, in the modern world, it is designed to work on a number of devices. Critically, it is empowering the clinicians themselves with verification through mentors or another to update and have approved the programs, the education and training, the capabilities and the skills that they're developing. So this is something that it can be driven by the individual clinician with support and with verification. My colleagues in INHWE have been working really hard and have timeframes built in to how rapidly they can deploy solutions based on identified skilled needs once requirements are identified with key stakeholders. The product can automate custom emails to request updates. So there's an intuition here that if somebody's undertaking some work, they can upload that themselves onto the system. But critically, you can also have ticklers whereby you can be reminded that certain skills are soon to be out of date. And that information can also be made available to the management or the HR manager or the professional training and development manager of the services. So if someone has to update themselves in things like BLS or ACLS or whatever is required, then you can track that through the system to enable you ensure that somebody's skills are not lapsing. Critically, it is ISO certified. The wonderful thing about it is that the management of it can be at a micro level. So additional capabilities and competencies and skills can be uploaded with guidance as requirements change. I've mentioned the triggers. And as I say, we are currently in negotiation with our National Health Service, with Nursing Homes Ireland, with our Ministry for Health and Chief Nurse, and we are exploring piloting the solution across a range of these services. There is some interesting research going on in this jurisdiction led by our Department of Health Chief Nurse in relation to safe staffing. So our intent, our hope is to co-pilot this solution with some of those services. But we're going beyond that as well. We want to see and we want to demonstrate that this system can work across a range of services, from home in the community providers to nursing home providers to the acute services as well. We are very confident and indeed we are assured that the software is highly configurable. And a typical project plan that we've developed is over 4 phases, whereby we are able to go from confirming the requirement, identifying the needs, building the alpha version, then building the beta version, and then providing support and assurance beyond that time frame. So, thanks very much for listening. It's a tough ask. It's just before lunch, and it's virtual. My name is Thomas Kearns, as David said, and if anybody out there wants to discuss the solution with us, please contact me directly, and be reassured that if your clinical information officer teams want to be involved in this, we will have our colleagues from INHWE there to answer what I would consider to be the hard questions in terms of technology, capacity, interoperability, GDPR, all of those challenging subjects. Thank you very much.